It was only a matter of time, man. It was only a matter of time. That's just basically it. It was only a matter of time. They're going to force this on us one way or the other. Mandatory coronavirus vaccination bill introduced in New York State Assembly. A New York lawmaker has introduced a bill making vaccinations against the Wuhan coronavirus mandatory. Democrat State Assembly member Linda Rosenthal introduced the bill December 4th, which is currently being reviewed by an Assembly committee as of writing. Rosenthal's proposed bill mandates vaccination for all individuals who are proven to be safe to receive a vaccine for COVID-19 if public health officials determine that New Yorkers are not developing sufficient herd immunity. Rosenthal's Assembly Bill A11179 states that a vaccine approved by both the Food and Drug Administration, the FDA, Center for Biologics Evaluation and Research, and the state's Clinical Advisory Task Force shall be required to be safely and effectively distributed in accordance with the New York State Department of Health COVID-19 vaccination program. The bill's support memo outlined while steps have been taken to reduce the spread of COVID-19, epidemiologists and public health experts have concluded that a vaccine will be necessary to develop herd immunity and ultimately stop the spread of the disease. It also remarked that the state must make efforts to promote vaccination and ensure that a high enough percentage of the population is vaccinated to develop sufficient immunity. Rosenthal's proposed bill does not define sufficient immunity, which leaves the definition to public health officials. In an interview with Fox 5 New York, the legislator remarked that the compulsory vaccination mandate should take effect if less than 70% of the population voluntarily gets immunized. She said that with the mandate, the State Department of Health would have the ability to say that more people have to get the vaccine and would set the rules and the structure. The bill also provides for exemption. Anyone who has received a medical exemption from a licensed medical professional will be excluded from the forced vaccination mandate. Nursing homes are always the testing ground for New York State's public health mandates. The proposed mandatory immunization bill comes amid Wuhan coronavirus vaccine candidates proving effective in clinical trials. Candidates by Pfizer, BioNTech, and Moderna have registered more than 90% efficiency rates, while AstraZeneca experimental jab registered a 70% efficiency rate with 2 full doses. The UK recently approved the Pfizer and BioNTech vaccine BNT162b2 for domestic vaccination. In line with this, Governor Andrew Cuomo announced December 2nd that the state will receive COVID-19 vaccine doses sufficient for 170,000 people by the middle of the month. The initial batch from Pfizer will be distributed to nursing homes, with residents and staff members to be immunized first. Cuomo said during a coronavirus news conference that subsequent shipments of vaccine doses will bolster the state's vaccination efforts. You need doses good for 210,000. In 2 weeks, you're supposed to get a Moderna shipment, which would be at least 40,000. So between 170,000 and the Moderna doses, we could cover the entire nursing home population. And then another shipment of Pfizer vaccines coming. So it's on a rolling basis. Interestingly, Cuomo was also responsible for ordering nursing homes and long-term care facilities to accept COVID-19 patients through a March 25 mandate. The Associated Press reported that more than 4,500 patients were shipped off to nursing homes around the state. Cuomo eventually scrapped the mandate in May, but not before causing more than 6,400 deaths. Related New York nursing homes now a slaughterhouse for elderly coronavirus patients. The mandate drew criticism from various people and even merited a congressional investigation. In response, Cuomo claimed that the infective care home workers were the ones to blame for the spread of the COVID-19 in nursing homes, which he called fire through dry glass. He also rejected calls for an independent investigation of his mandate, claiming they were politically motivated. The mandatory vaccination law follows the U.S. remaining as the country with the most number of COVID-19 cases. Johns Hopkins University data shows that the U.S. has a 15.6 million COVID-19 caseload with 5.9 million recoveries. and 292,179 deaths. Great. I don't know what to say about this, man. But if you can, get out of New York. That's all I can say about this. It's sad, but this is how it's coming. This is coming down to that. People are going to have to leave New York. A lot of people are leaving New York as it is. Okay. If you go to the Caribbean, so be it. But it's going to get bad, people. It's going to get bad. If you like the content, like, share, comment, and subscribe.